Um, we've tried to save the end for really the summative comments and to leave you with a sense of where we're going next. So I'm going to make some concluding remarks from what I see, and then we're going to have a really interesting presentation about systems. So I hope that you will stay tuned on your computer or wherever you're watching on, or stay here. So these remarks are really going to talk about what I think we were trying to do and what we did, what I heard. I decided to make a word cloud to just feel, through the keyboard some of the things that I had heard. And I'll comment on some of the themes. They are not always the largest, but I had to make this Wordle in real time, so I didn't make it as an intention. It's more symbolic to say that we talked about a lot, and some things came through loud and clear, and they came through loud and clear from a lot of different people. One is that we really need to appeal to hearts, minds, a sense of justice, to power, and to money. So probably those are the key things that cut through all of the presentation. When you think about that offensive commercial that you saw, I mean, that appeals to almost all of those things, for example. So we have to go through all of those. We can't just be technocrats. We have to understand the field that we're working in. We heard a lot about civil rights, that race and gender are the issues that have teeth in law, and that we should differentiate between laws and policies and understand where we need the force of law to get some things done, where we can find deliberate discrimination. We also heard from one of the commentators that when we're programming in communities for obesity, we should have civil rights in mind. We should be trying to lift the community with every single thing that we do, not just solve the health problem, because we do need to address the social determinants. We heard a lot about cross-sector linkages, and I deliberately decided to make that one big on this slide because it's fundamental, not sectors working in their own corners of the problem, but working together. Finding win-wins so that I think Sarah Black put it, finding the sweet spot where there are no losers, where you have a win-win in whatever sector that you're dealing with. Another thing I heard really often was time. Time to see the effects. Things don't happen overnight. People said it in different ways. It's a key factor for evaluation and data collection, and I thought that we should really put our strategies on a time map in the short, mid, and long term, so that when we try to evaluate, we kind of know when we should expect to see the effect and can plan our studies accordingly. I heard about adults. I think adults as a focus for childhood obesity prevention have not gotten enough attention. Adults are key to healthcare settings. Adults are in work sites, and what happens with work sites affects adults, which affects families, which affects children. Adults are role models. Adults include college students who are role models for kids. Adults may respond in a work site to collective appeals, not just their individual self-interest. We heard about leveraging adults' concern about their children, because after all, adults are the decision makers for a lot of these things. And adults helping to set standards and redefine things, and so forth. And then some of the things, you see tap water really big on the slide. We heard that there's a lot of key targets, things that we know if we fix them it would help. And they came through in the different settings. Staff training, mapping, taking things to scale, using care extenders in the health care system. So I hope that as we digest the results of this into the workshop summary, we will be able to pull these things out in an organized fashion. And in that sense, I'd like to go back to the questions that I posed at the beginning. One was, what does accelerating progress mean for creating equal opportunities? And I will elaborate on that in a couple of ways. One is to refer back to the APOP report and the overall strategy that the APOP report recommends, which is population-oriented approaches, community engagement, changing environments, using big P and little p policies, and reaching people, because a lot of people said that we have to remember that it's individuals ultimately that we're trying to influence, and so we have to keep them in mind and how they interact with their environments. And then we have to target these to the high-risk communities. Targeting raises this question of lumping and splitting, and I'll come back to that in a few minutes. So here's the landscape where we think the action is needed. There should be synergy here, but the menu of recommendations, I think, is laid out in the report. And we talked about two sets of complementary environments. So even though there are 6 things written here, 3 of them are the type of environments we want to change: the food and beverage, physical activity, and messages. But on another level, we're targeting critical settings. So universal access in schools and things around schools will get to populations at risk. And we know that there's some schools that have higher proportions of high-risk populations. For work sites and healthcare, we really haven't articulated this very well. I was listening closely during the session, and I think that because we haven't thought about adult settings as much for childhood obesity, we have more thinking to do about what we should really be doing in these settings that target. So we got some good ideas at the workshop, and I think there's more thought there because these settings are really, really critical. So adult health care settings and child health care settings, and as well as work sites. We mentioned both race, ethnicity, and income, and I just included this slide from Health United States to remind people that children in the ethnic communities where we have most data, and in most of the ethnic minority groups, are living below the poverty line. The longer bars at the top, under 18 years, 29% of Hispanic and 35% of Black children below 100%, and then 32 and 26% between 100 and 200%. So a lot of these issues overlap quite a bit. American Indians and Native populations are not on the slide, but there's a lot of poverty in those communities as well. So both of these issues are important. I mentioned in the opening remarks frameworks, and I heard the frameworks implicit in what people said, but no one specifically unless I missed it, mention theoretical frameworks that they were using to decide about how to accelerate or how to focus on disparities. So that gave me a chance to mention some. I love frameworks, so I'm going to mention 3, and I would put the references here because I think as we go forward, we really should have clear ideas about what we're looking for and how to go about it. So this is one from Paula Braveman that she adapted from a framework from someone at the Karolinska Institute, and it shows the things we've been talking about: social position, race and class, specific exposure, these are the white boxes, a disease or injury, and the social the consequences of having an injury. So is there differential exposure by social position of race or race and class or gender? And if so, then decreasing exposures is the intervention to address that. If there's differential vulnerability to the exposure, then you want to find a way, you're blocking that pathway, you're decreasing vulnerability, or are you trying to block differential consequences? So that's just a way of thinking about it, and the references there, again, you can read more discussion of how you might use that. The next one, which I used a lot, it's a general framework for analyzing environments with a focus on obesity, developed by Swinburne and colleagues in Australia and New Zealand. And I've used this to think through the environments for African Americans. So you look at the size of the environment, it is the micro or the macro. You look at the settings and the sectors, and you think about this through separately for food and physical activity. And the types of environments, physical, we've been talking about, economic environments, we've been talking about, policy environments, what are the rules that affect the physical and economic environments, and then we talked about social cultural environments as well. This framework has actually been elaborated quite a bit in used to develop community action plans, bringing in public health tools like problem and solution trees. So I offer this as one that's possible to use. And this is, I don't expect you to be able to read this, but you can refer to the article. It actually was led by Tony Yancey, and it is an analysis of the physical, economic, and social cultural environments that we adapted from a chapter I had written on obesity. And if you look at if you could see the cell entries, you will see that almost everything we've been talking about is in this grid, and you can place it, and then you can think, okay, where do I want to intervene, and how do these things relate to each other? But it gives you a framework. And the last one is from a research network that I formed, and of which some members have been here and participated. And this is one that has been adapted for talking with communities about analyzing the environment. And I think it applies to other ethnic groups. In fact, it's been applied to Latinos as well. It relates to both food and physical activity. And the three domains are the historical and social factors, you know, how people's history and where they came from, and the social factors influence the way they go about eating and physical activity. The culture and mindset, all the psychosocial issues, what people believe in, what gives us pleasure, and then the environments that they're navigating, economic and so forth. So this has been very well received, talking with community groups, just posing these questions and starting to talk about things to bring forward the environments, because people may tend to blame themselves. They may not see that the environments are affecting them, so you have to have ways to articulate that. The last questions perhaps would be an organizing principle for some of the workshop reports. Which of the recommendations are the most important? I think that the moderators did an excellent job of bringing those recommendations out. Needless to say, I can't list those here. And the case studies and policy commenters also did a great job of talking about specific implementation approaches, tailoring, and improving effectiveness. So the last three questions, are there gaps in the APOP recommendations? I think that we did hear a few areas where more emphasis might be needed, or where a specific recommendation could be inferred from some of the things that individual speakers have said. This lumping or splitting issue really becomes important for evidence, because the question is, do we need to repeat all the studies that have been done for every subgroup of every population at high risk? How can we use the evidence that we have to apply it to the high-risk populations, and where do we need to split? Where do we really need to go in and do a deep dive and understand the issues specifically for a population? I think that's going to be, as a resource question and a time question, one of the biggest things we have to grapple with, and this workshop has set us up to really think through that, make the best of what we have, and but find out where we need to be more specific. What are some important next steps? One is to learn about how this fits together when Ross Hammond talks about the systems approach, and get this workshop report out, disseminate it, and use it to help people recognize that there is a systematic way to think about issues, that we do know a lot, and that we need to keep our eye on the prize in terms of targeted solutions that will not only give equivalent solutions, but better solutions in order to bring people up on par as we go forward with the struggle. So I now will bring Ross, invite him to come up and talk. His bio is in the book. He's an economist, a specialist in system science, as I said, at the Brookings Institution. He was a consultant to the APOP committee to help us think through the separate recommendations as they related to each other.